Hey class, today we're going to talk about Chapter 8, the female reproductive system. First, let's take a look at the major organs of the reproductive system in the female. We can see the uterus up here, which is in the bottom of the pelvic cavity, just superior to the bladder. The uterus has a uterine tube or fallopian tube coming off of either side of it that surrounds the ovary. So you have two ovaries, two fallopian tubes, one uterus. The inferior part of the uterus is called the cervix, and the cervix opens into the vagina, which opens into the vulva. The vulva consists of the clitoris, the labia minora, and the labia majora on either side. So a single clitoris and then labia minora, labia majora on either side. Just anterior to the vaginal opening, we have the urethral opening. The urethra goes up into the urinary bladder. And just posterior to the vaginal opening, we have the anus, which connects into the rectum and then up into the rest of the digestive system. So those are the main areas that you need to know for the female reproductive system. This is giving us a better view of simply the female reproductive system, not inside the body. So we've got the uterus here. The uterus has three parts: the fundus, which is the superior-most part, the body, which is the central part, also called the corpus, which you can see here, and then the most inferior sort of conical tapering at the bottom of the uterus is the cervix. The cervix protrudes down into the vagina, and then the vagina ends at the hymen, which is a very thin layer of tissue that is often broken during first intercourse, or these days sometimes with tampon usage or even injury. Off either side of the uterus, we have a uterine tube, also called a fallopian tube, and the fimbriae are the ends of the fallopian tube, which look like little fingers that kind of hang over the ovary. So when the ovary releases an egg, the egg travels into the uterine tube. If it's going to be fertilized, that happens in this outer 2/3 or outer 1/3 of the uterine tube. And then the egg travels down through the uterine tube into the uterus. If it's been fertilized, it should implant into the uterine lining in order to grow an embryo. And if it has not been fertilized, then the uterus will shed its entire lining through the vagina, and that is the monthly menstrual cycle. Externally, for female reproductive systems, we have the vulva, which contains the clitoris, and then we also have the mammary glands, which are the breast tissue. Internally, as we already saw, we have the vagina that opens up to the uterus. Then we have the fallopian tubes that end at the ovaries. There are also a set of glands that open into the vagina. You can see them here. These are called the Bartholin glands, and they produce secretions to keep the vagina moist and allow for decreased friction with intercourse. As we stated, the breast tissue is part of the female reproductive system. So these are the mammary glands. They sit over the pectoralis major muscle, which you can see here. And they're full of glandular tissue that secretes milk in a postpartum woman in order to nourish the newborn. That glandular tissue is surrounded by fatty areolar connective tissue. We then have the areola, which is the darkened portion around the nipple, which is the portion where the glands come to the surface and milk is produced or ejected for feeding the newborn. Some of the combining forms that we see with the female reproductive system include the cervix. So in reference to the cervix, we can use the word cervico or trachello. Cervico is typically used when we're describing diseases of the cervix, while trachello is usually used to describe procedures that are being done to the cervix. The uterus can be referred to as hystero or metro. The vagina is vagino or vagino or colpo. The breast tissue is mammo, like mammogram, or masto, like mastitis. The ovary is oophoro. You do pronounce both of those O's. So oophoro, so if you were to remove an ovary, it would be called an oophorectomy. The fallopian tube is referred to as salpingo, but if you're using it as a suffix, then it would be the word salpinx. And we'll see that in the next slide. So as you figured out by now, a lot of our combining forms are used in multiple different chapters through multiple different systems. So here we're going to use the suffix salpinx, which refers to the uterine tube, and some of these combining forms that we've seen before. So can you remember what those mean? And I'm going to give you a minute. We have hemato, hydro, and pio. So hemato refers to blood. So a hematosalpinx is where there's blood in the uterine tube. Hydro refers to water or clear fluid. So a hydrosalpinx is a uterine tube that is sort of dilated with water or clear fluid. And pio refers to pus. So a piosalpinx would be a uterine tube full of pus, which would be due to an infection. A few prefixes that you might see are a, which we've seen before, meaning lack of. So amenorrhea is lack of a menstrual cycle. Dys means painful or difficult. So dysmenorrhea is a painful or difficult menstrual cycle. In reference to the uterus, we often see peri. So perimetritis is inflammation of the perimetrium, which is the outer lining of the uterus. So when we see the uterus, it has three different layers. The perimetrium is the outermost layer. The myometrium is the middle layer, which is the thickest layer and is the muscular portion of the uterus. The uterus is a very muscular organ. And then the endometrium is the innermost layer, which is the layer that gets shed every month in the menstrual cycle, or that proliferates to help with implantation and then support of a growing embryo and fetus. Sometimes we see confusion between the prefixes endometrio versus endo. Endometrio refers to the inner lining of the uterus, that endometrium that we just talked about, whereas endo itself means within. So if we're seeing the term endometriosis, that is using the endometrio prefix, and it means a condition of the inner lining of the uterus. Remember, osis is a condition of. All other instances where you see the word endo, it is meaning within. So endocervical is within the cervix. Some suffixes that we see with the female reproductive system include klesis, which is surgical closure of, osis, which is a condition of, raphe, which means to suture or repair, like in stitches, rhea, which is flow, salpinx, which we've already seen, refers to the uterine tube or the fallopian tube, and algia, which is pain. So we learned that algia, the suffix, means pain, and it is used very commonly throughout this book and throughout multiple different systems in medical terminology. The prefix odino and the suffix odinia also refer to pain, but they're less frequently used. One place that I do see odinia used regularly is coxodynia, which is pain in the coccyx, which is also the tailbone. So coxodynia is pain in the tailbone. To help you with these disease and disorder terms, I broke them each down for you. So dysmenorrhea, you can see, is using the suffix rhea, meaning flow, dys, meaning painful or difficult, and meno, referring to the uterus. So this is difficult menstruation or difficult flow from the uterus. Endometriosis is endometrio/osis, which is a condition of the endometrium. So that's when endometrial tissue grows outside of the uterus, typically around the ovaries, the uterine tubes, throughout the intestines, and it can even travel to distant regions, including the brain. Mastitis is itis, inflammation. Mast is of the breast tissue, so we have inflammation of the breast tissue. Salpingocele, a cele is a collection of fluid. Salpingo refers to the uterine tube, so a salpingocele is a fluid collection within the uterine tube. Last, we have vaginosis, so it's vagino and osis. Osis is a condition of the vagina. Some diseases and disorders that are not built from word parts include the Bartholin cyst, which is a cyst of that Bartholin gland that we saw, which is just superior to the vaginal opening. Cervical cancer, which is cancer of the cervix. Pelvic inflammatory disease is an infection that causes inflammation throughout the pelvic cavity. Uterovaginal prolapse is where the uterus and the vagina are falling. Remember, prolapse means to fall. And so the uterus can actually sort of fall out of place, and it can even fall down through the vagina. A vaginal fistula, remember, a fistula is an opening between two structures. So in the vagina, if you were to get a fistula, there are three different kinds. There are vesicovaginal fistulas, which are an opening between the vagina and the bladder. Colovaginal fistula, between the vagina and the colon. And rectovaginal fistulas, which are between the vagina and the rectum, all of which would require surgical repair. Here we have some surgical terms that are built from word parts. And sometimes students get nervous when you see a very long word like colpoperiniorrhaphy. But if you break it down, rhaphy is the suturing of, colpo refers to the vagina, perineo refers to the perineum. So it is suturing or stitching of the vagina and the perineum. Colpoplasty is a surgical procedure to the vagina. Hysterectomy, ectomy means surgical removal. Hystero refers to the uterus, so surgical removal of the uterus. Remember, oophorectomy would be surgical removal of the ovaries. Mastectomy is surgical removal of breast tissue. And salpingostomy, stomy, is the creation of a hole. And so this is creating an opening within the uterine tube. So a salpingostomy would be the reversal of a tubal ligation. So if you get your tubes tied and then you decide that you would like to have a baby, it's possible that they could create another artificial opening within that uterine tube to allow you to become fertile once again. Here I just want to take a look at these two terms. So we have trachelectomy and cervicectomy. And both of those mean the same thing, which is the surgical removal of the cervix. Trachelectomy is the preferred term when you're describing this surgical procedure. However, cervicectomy is also an appropriate term. It's just not used as commonly. Procedural codes use the definition more so than the actual terminology. So when you're looking for a procedural code, you're going to see a code for excision of the cervix. Here we have some surgical terms that are not built from word parts. An anterior and posterior colporrhaphy, or an A&P repair, is when we look at rhaphy, that means suturing of. Colpo refers to the vagina, so it is anterior and posterior suturing of the vaginal wall. So the vaginal wall can weaken when you've had multiple vaginal births, given birth to an extremely large child, or had some severe trauma. So they can suture that back together in order to keep it from becoming too weak, and at which time you can end up with prolapsing organs in that region. Conization is the removal of the lower, most inferior cone-shaped part of the cervix. This also includes the LEEP procedure, which is loop electrosurgical excision procedure, and that is used to treat cervical cancer. Endometrial ablation is the use of a laser to remove endometrial tissue that is growing outside of the uterus. So this is how endometriosis is treated. So they can do it laparoscopically. They go in with a scope and some tools, and they look all through your abdominal pelvic cavity to see how widespread the endometriosis or endometrial tissue is. A tubal ligation is having your, quote, tubes tied. So that is where they are cutting the uterine tubes so that the egg cannot travel from the ovary down into the uterus for fertilization and implantation. Some diagnostic terms that are built from word parts. A colposcope is a scope that looks inside the vagina. A hysteroscope or hysteroscopy is using a scope to look inside the uterus. Mammogram is a radiation procedure that produces a image of the breast tissue. And then sonohysterography is also known as saline infusion sonography. It's a non-radiation ultrasound procedure that allows the healthcare provider to see inside the uterus. Some diagnostic terms not built from word parts include the CA-125 test, which is a blood test looking for a tumor marker. CA-125 is a tumor marker that is high in uterine cancer, and it can also help to predict outcomes with breast cancer. The PAP test is a test that's named after Dr. George Papanicolaou, who was a Greek physician practicing in the United States who developed this cell smear method for the diagnosis of cervical cancer. It is mostly used for cervical cancer now, though you could use it for scraping cells from any organ and looking at them under a microscope. Sentinel lymph node biopsy is the biopsy which is taking a sample from the sentinel lymph node, which is the lymph node closest to an area of cancer. So if there is a tumor, that very closest lymph node is the sentinel lymph node. Transvaginal sonography is an ultrasound that is where the wand is inserted in through the vagina, and you can use that to look at all of the female reproductive system. It's also used widely with early ultrasounds for pregnancy to make sure that everything is looking healthy. You can date a pregnancy that way prior to being able to do an external ultrasound on the abdomen. Some complementary terms built from word parts. Endocervical, meaning within the cervix. Leukorrhea is flow. So rhea means flow, leuko means white. So this would be a white colored discharge from the vagina. Mastalgia is pain, algia, masto, breast tissue. So this is pain in the breast tissue. Vulvovaginal is referring to the vulva and the vagina. Some complementary terms not built from word parts include anovulation. Remember, an means a lack of, so it's lack of ovulation. Dyspareunia is painful intercourse. So that can happen for many reasons, endometriosis being one of them. A speculum is a tool that is used in the inspection of the female reproductive system. Menarche is the onset of menstruation, so the first menstrual period is considered the menarche. And then menopause is the cessation of the menstrual cycle. So menarche is the first menstrual period, and menopause is the end of the menstrual cycle. Here we have some abbreviations common to the female reproductive system. So D&C, it refers to a dilation and curettage, which is where they go in and dilate and then scrape the inside of the uterus or the uterine lining. This can be used to treat multiple disorders of the uterus. It can also be post-miscarriage. If somebody is having a hard time clotting and they're bleeding excessively, a D&C can stop that and take that tissue out. FCC means fibrocystic breast changes. HSG is for a hysterosalpingogram, which is a procedure looking at the uterus and the uterine tubes. An IUD is an intrauterine device, which is used for birth control. And TLH is total laparoscopic hysterectomy, which is where the entire uterus is removed using a laparoscopic procedure. So there are no large incisions in the abdomen in this total laparoscopic hysterectomy. So thanks for joining me today to learn more about the female reproductive system. I hope you have a wonderful week.